Hello, Dr. Brent Bost for WiseOB. I want to talk with you today about pain control in labor. No doubt you're pregnant if you're looking at this and wanting to know more about your options. No doubt you've heard that the baby has to come out your body, and it's going to be intense and require some effort. This is not something I'd recommend doing flat-footed. Get prepared. So hopefully today I can give you some basic information about your options. There are basically three main choices that women have in this situation. The first is kind of lumped together as natural childbirth. And you've heard of the Lamaze technique. There's Bradley. There's several others out there. Most of these techniques involve breathing and focusing concentration, ways of either self-hypnosis or distraction to cope with the pain. Now it works, people have had babies for thousands of years. In fact, when I say people and women, I mean the same thing. I probably explained that to you in a previous video, but to me, women, patients, people are all the same. They're all women. So sorry guys, you don't qualify for me. Nonetheless, these techniques have worked. Well, what's the history of pain control in childbirth? Well, of course, it started out 10,000 years ago as making it through, more like 10 million years ago, probably. But probably more like 100 million years ago. But anyway, a long time ago. And then about 1,000 years ago, people started looking at things that would kind of expand your mind or take the pain away. Opium, peyote, things like that were out there and have been used through the years. Alcohol, which is not particularly recommended. In the 1800s, a big breakthrough, ether, chloroform, and this evolved into nitrous oxide and other gases you could breathe and kind of take your mind off what was happening. In 1950s, twilight sleep was very popular, and this was when I was born. And my mother tells me over and over again about her experience having me. Basically, she was given morphine and scopolamine, which induced a sort of a control psychosis. And literally, some women had to be placed in cages so that they wouldn't hurt themselves, crawl away, et cetera, et cetera. She doesn't remember the birth of the baby, which was me, of course. She remembers the afterbirth pains, which lasted for probably 40 years. But she didn't remember the actual birth process. She remembers waking up or becoming aware of herself and her environment the day after delivery. She told me she picked spiders off the wall during her labor process. So, that was an interesting era, right? In the 60s, three different approaches sort of to emerge because everyone knew this was not the best way to go. Better medications came out, better pain control medications. Regional blocks, things like spinals, which used to be called saddle blocks, and then epidurals eventually. And then things like Lamaze, et cetera, came out of that era. That was the natural childbirth approach. And of course, you can see, based on what they were seeing in the 50s, this twilight sleep deal was a terrible situation. And a lot of women complained that they couldn't remember anything. They didn't want to experience the pain of childbirth, but they just couldn't remember the birth. They didn't enjoy it. It was a tough era. And so natural childbirth sprang out of that. And of course, I always joke about natural childbirth versus unnatural childbirth, but nonetheless, that natural childbirth era came from as a response to the twilight zone. Of course, it stresses breathing and maintaining control in spite of the pain. And Bradley and other methods are out there, but pretty much they're all self-hypnosis. These require training. You can't just walk in flat-footed and do this. And it also requires a commitment. I liken it to running a marathon. You have to train up to your marathon and be ready. You can't just run 26 miles flat-footed, so to speak. You can't just start and go run a marathon. Now, Forrest Gump did it, but most other people really can't do it. And so you have to be prepared for that. You have to be prepared and train your body, get ready for it. And you also have to be mentally prepared to go the whole distance. Most marathoners will tell you that last 2 or 3 miles is a killer, and you have to be ready to make it through or you'll just stop. You'll just give up. And so a lot of women experience natural childbirth the same way in that transitional point of labor, 8, 9, 10 centimeters, when there's the urge to push, when things seem to be getting out of control, that if they're not prepared, they're going to lose it and want to do something else. So if you want to do natural childbirth, you have to be ready for it. Take classes and get your head wrapped around what you're about to accomplish. Now, the advantages of natural childbirth is that there's no medication, no sedation during the labor process, no hangover afterwards, no needles are required, although I think everyone should have an IV in labor. This is a safety device, okay? Everyone needs an IV in labor. I'm sorry, no matter what you hear about it, you need it. It's like having term life insurance on your husband. It costs money. You kind of hate to spend the money on it, but man, if you need it, you needed it, okay? And IVs are the same way. It may save a baby's life on a regular basis to have an IV in place. Of course, some claim that you're better able to push. I would argue that sometimes the pain gets so intense that some women can't push. But in general, there's no sedation, and that's what women have liked through the years. And this allows you to walk longer in the labor process, move around, get in the jacuzzi later in the process, etc. Doesn't mean you can't do it other ways, but you can do those things later into the labor, further into the labor if you want to. Disadvantages, it's not for everybody, okay? And the Lamaze people will tell you, oh, you can make it? And I said, yeah. If I locked you in a room with a bucket of water for 2 weeks before your due date, I guarantee when I pulled you out of the room, you'd have your baby, okay? We may not be friends any longer, but you'll make it through. It's a process. You can't just say, oh, I'm tired of this. I'm going to back out and do something else, right? So it'll work. Oh, yes, you'll get through it. But some people really don't. It doesn't suit them very well. And if you did need an assisted delivery with forceps, sometimes vacuum, or even a C-section, it won't get you through. You've got to do something else for that, okay? What's your next step? Well, probably the next logical step is intravenous or IV pain medications. The short-acting are better because you can redose people if you happen to give them a dose and the labor progresses faster than expected. Well, then they're not sedated, baby's not sedated, and that's important. The advantages are, again, there is some mild to moderate sedation, allows you to get through, takes the edges off, right? It's not 100% like an epidural would be, but it takes the point between the worst space between place in each contraction is further apart. It takes the edges off of those humps of pain that you have, the peaks at the worst and down on the sides. It takes those and makes them further apart. It takes those peaks further away and lets the time go by faster. Okay, it's a time. It causes time compression just like sleeping does. It helps with relaxation. That's very important. And some people really need that to have a baby. You can get really tense and tight fighting that pain and not be able to relax. And so sometimes the relaxation is very important in making labor progress. And there are no needles, of course. Like I said, you do need to have an IV in, but no needle in your back, which is what people worry about when you talk about epidurals. And you can usually push pretty well unless you're just totally sedated. That's very unusual, though. We do our best not to do that to you. Disadvantages, it's not enough pain relief for a lot of people, probably 60+% of people. In my practice, more like 80%. Timing is critical. You don't want to give it too close to the delivery because it might sedate the baby, although we can reverse that. But nonetheless, we don't want to do it, going into it. So sometimes patients will arrive at advanced stages of labor wanting some IV pain medicine. It's like the baby's coming too quick. We really can't give that to you. And so that's one of the negatives about that technique, right? Nausea happens to some people when they get the medication, but it's very treatable, just like sedation is. And you're a little less ambulatory. Once you get that medicine, you're a little wobbly on your legs, and so we don't really recommend getting up a lot afterwards, although you can get up with assistance to go to the bathroom and come back, stuff like that. The IV pain medicines often provide what I call an in-betweener between going natural and having an epidural. And so sometimes patients use that as an intermediary step. Well, what about epidurals? You probably know a little bit about them, and we'll have another video soon that talks about epidurals that you can look at, the actual technique itself, okay? But it's basically like going to the dentist. You get that local anesthetic in your jaw, and it goes numb for a while, and then you come back after a couple hours, and you can do what you need to do. It allows them to get done what they need to do, which would be painful without it, and lets you not be totally sedated, etc. The advantages are it's like 90 to 100% pain relief. Some people still feel some pressure, but sharp pain goes away. This offers maximum relaxation, and someone really need this. I've had patients struggle with natural childbirth, go for a day even in labor and just miserable, can't get there. They're 6 centimeters, they're stuck at it, slip an epidural in, and they're completely dilated immediately afterwards. It's because that relaxation is critical for some women. If you have very powerful pelvic muscles, and this is particularly true of my athletes, is that you get that epidural and it relaxes everything, and you can have your baby a lot quicker sometimes. The natural athletes, unless they're able to really relax, sometimes will hold the baby up with those powerful muscles they've developed over time. There's no sedation for mom or baby. It's gone about an hour and a half to 2 hours after delivery, and it can be advanced if you did need forceps or vacuum delivery or maybe a cesarean section. They just make the epidural thicker, if you will, and you can do it with the same block without having to have a second anesthetic procedure, okay? Well, what are the disadvantages? Well, you need to be in the hospital. You have to have an IV, and again, I think an IV is a very important adjunct for everybody in labor. It requires this really simple procedure by an anesthesiologist. Sometimes obstetricians do them. I did all my own epidurals for the first about 15 years of practice. It requires a Foley catheter, but it's placed after you're numb so you don't feel it. And it limits your ambulation because if your legs are no longer functional, you can't really get out of bed. We let occasional patients do it, but they're really crazy laying on the floor. No, we don't do that. But there's no way you can really get up afterwards. That's the key. Now, there are a lot of myths out there about epidurals, and let me get rid of those for you because they're perpetuated by the people who oversell natural childbirth. And most people who promote natural childbirth are good people. They want you to have the best experience possible. Some of them are a little crazy, though. They're a little overzealous, okay? And so they'll start selling these myths to get you to do what they think you should do for the best outcome. And like I said, they're not perverted in doing it. They just don't understand it. And they perhaps themselves have been sold a bill of goods. One is they'll say, well, the medication goes to the baby. Well, technically, it can be detected in some babies' bloodstreams. But when you go to the dentist and have your jaw injected for your tooth work, the medication, that local anesthetic that they give you, also shows up in your bloodstream. But you don't feel crazy or weird. It doesn't stop your heart. It doesn't do anything bad to you at all. Well, if any of it happens to get to you, which some of it will, you'll never notice it. And the baby wouldn't either if it does get to the baby. So that's a myth you don't have to worry about. Now, IV pain medicine, it can. Like we said, it could sedate the baby. But in most cases, it won't. And we try to time that IV medicine so it doesn't do that. Another myth about epidurals is it increases the length of your labor. You're going to labor a lot longer with epidural. Well, there are studies done that don't control for labor. In other words, they took all comers. They didn't diagnose labor first before they put the epidural in. Well, those patients weren't really in labor yet, right? And so with first contraction, I need my epidural. Some people feel that way, but they're scared to death of labor, right? And so those women have a much, much longer labor because they really weren't in labor in the first place. And that's the problem with a lot of the data that's out there, is that they didn't control for actually being in labor. If you make the diagnosis of labor first and then put an epidural in, it doesn't appreciably increase the length of labor. Perhaps you push a tiny bit longer, but if you're numb and if your labor is lengthened by an hour, let's say putting an epidural in, if it's an hour you didn't hurt, do you really care? The answer should be no. Okay, so lengthening your labor a tiny bit is really irrelevant. Now, the studies that show much longer labors are not appropriate because they didn't prove that everyone was in labor first before they got their epidural. Okay, similar myth about cesarean section is that epidurals increase your risk of cesarean section. Now, there are some research studies out there that would tend to indicate that that's true. However, if you look deeper into that literature, you'll see that in the studies that show a longer labor, the patients were not necessarily proven to be in labor before they got their epidural. That is a critical thing to remember, okay? And people will misrepresent that data to you to try to sell you that an epidural will cause C-sections. It does not. That is not true, okay? I'm sitting here right in front of you, flat-footed, bald-faced, telling you that is not true. It does not lengthen your labor in any appreciable amount. It does not increase your cesarean risk at all. There are multiple studies that looked at that, showing there is no increase in the length of labor for women who get an epidural as long as you're in labor before you put it in. And that's critical. I'm going to come back to that in just a second. So overall, I would quote my mother on this one. That is, pick your poison, okay? Natural childbirth versus IV meds versus epidurals, okay? Natural childbirth is fine. I have no problem people selecting natural childbirth. I've run a couple marathons. And so you pick your challenge and you do it. And I have no trouble if that's a challenge that you choose to pick. An epidural is no problem. The risks are extremely low. It works really, really well. And if that's what you want, pick it. Don't be afraid. Be flexible is my recommendation to everybody, particularly that first baby, because the first one's the worst one. You have no clue what you're getting into, right? You just don't know. And I will also say the best laid plans of mice and men sometimes go awry, okay? And a lot of women get there thinking, oh, I can do this, and go, oh, I cannot do this. So be prepared to be flexible, okay? Natural childbirth, that process requires commitment, but not craziness. I've had patients come to me who've been in a birthing center in natural childbirth trying to get that magical golden goal of I'm going to get my baby the old-fashioned way and just be wiped out, okay? Wiped out. And put an epidural in, and life is so much better. They sleep for 3 or 4 hours, and they can come back at this and have a baby vaginally in many cases. but they were just exhausted by the time they got there. And I think that process, that having your goals trashed, is one reason why a lot of women have postpartum depression. If you set your sights on, I'm going to have a natural childbirth, it's going to be wonderful, there'll be champagne and roses, you're going to be just as disappointed in that process often as you were the first time you had sex. Now, if your husband's listening to this, nod your head, of course not, it was wonderful. But if he isn't here, you can tell the truth. You think the first time I have sexual intercourse, it's going to be all in love and wonderful. And like I said, you'll hear the birds singing and the champagne will be flowing. And it was hot and sweaty and uncomfortable and it hurt. And then you bled afterwards too, sometimes. So you realize that when your expectations are not met, that causes feelings of worthlessness and depression, etc. And a lot of women have been so sold on natural childbirth that if they don't do it, they feel like they've let themselves and their baby down. And I'm here to tell you that is not true. You pick what's right for you, for you. Pick what's right for you. If you choose natural childbirth, just be prepared to shift gears. I've had patients begging their husbands for help. Please let me get something for pain. No, you said no beforehand. And I'm thinking, dude, if the cops were here, I would arrest you for that. But that's what the patient apparently had asked for beforehand. And most women get very disappointed when things like that occur, right? So the reality is just be flexible. Be prepared to shift gears because you just don't know what you're getting into. If you have really slow progress in labor and you've done your natural thing and you're holding on and doing great with it, you're controlled, you're in focus, but you're not making a centimeter an hour of progress or pretty close to that, and you're after 4 or 5 centimeters, so you're clearly in labor, but things are really, really slowing down, and you want to do something different, get an epidural, particularly with the first baby. Again, you just don't know what you're in for till you get there. Then if you want to come back and try it again with the second baby, you can do that. You haven't burned any bridges. The key is to have a safe delivery for a healthy mom and a healthy baby, and an epidural can do that for you if you need it. Natural childbirth is fine. IV medications are fine. Epidurals are fine. They're all okay, right? Pick what you want. Don't let anyone tell you what you need to choose or what you shouldn't choose. Don't let them goad you into or out of any of your options. And never, ever choose out of fear. I'm afraid of that needle in my back. Oh my God. No, it's a piece of cake. And if you want that, you can have it. I'm afraid I won't be able to do natural childbirth. Well, if you don't, you get there and it's miserable, you can always back into an epidural or something else, right? So you haven't burned any bridges. Just, again, don't choose out of fear and don't let people goad you into or out of an option. And again, trust your doctor or certified nurse midwife for advice on this situation, right? Ask them. They can tell you, okay? You went to them because you trusted them. If you don't trust their advice, you should go somewhere else. And I've told a few patients through the years that same thing. Look, if you don't trust me, I get it. It's cool. Not everybody likes me. It's all right. I could give you a list of people who don't think I'm the best guy in the world. Hopefully it's a short list, but it's true. And so if you don't trust your physician or your midwife, then go somewhere else. That's what you need to do. And I would recommend to everyone, deliver in a facility where you can have all 3 options available, but you just don't know what you're getting into. Don't get painted into a corner. And I'm not hating on birthing centers, but I'm just telling you, you can't get an epidural there. And sometimes if they can't transport you to a C-section that might be life-saving for you or your baby, that can be a real problem, okay? That can be a huge problem. I'll be producing more videos on that subject later, and there's a very large study that just came out about that. But go somewhere where you can have all 3 of these options: IV pain meds, natural childbirth, or an epidural. And that way you've got all your options in front of you. You choose, but be flexible. And a common plan a lot of women use is, I'm going to go natural first. And then if that's not going well, I can get some IV pain medicine to help me get through, but still stay, quote, natural. And if that doesn't work, then I've got an epidural for backup. And I think that's a very legitimate plan. And P.S., if you know you want to get an epidural up front, you should still go to childbirth class. Why? Because remember, to not mess up your labor with an epidural, you have to be in labor before you get it, which means you have to endure some aggravation before you get the epidural in. So be prepared for that, right? Childbirth class, great idea, a good investment of your time. And bring your husband too, so he understands what he's getting into as well. This is Dr. Brent Bost for Wise OB, and say choose wisely and it'll go well. Take care.